programang ito ay rated SPG. Striktong patnubay at gabay ng magulang ang kailangan. Maaaring may masiselang tema, lengguwahe, karahasan, sexual, horror o droga na hindi angkop sa mga bata.
The process of growth and development occurring in the womb from fertilization until birth is known as the prenatal development. The 38-week prenatal development is often divided into 3 periods. First is the germinal period, which is the time of the zygote. Second is embryonic period, which is the period of embryo. And the last one is the fetal period, which is the period of fetus. And now, I will discuss the 3 stages of the prenatal development. First is germinal period. Germinal period is within 1 to 2 weeks. When a sperm fertilizes an egg and forms a zygote, which begins as the one-cell structure, conceptions occur. The DNA of the father and the mother is passed on to the child at the moment of conception. At this point, the genetic makeup and sex of the baby are set. The germinal period is about 14 days in length and would last from conceptions to implantations of the zygote or the fertilized egg. The zygote travels down the fallopian tubes and implants itself in the lining of the uterus after divides for about 7 to 10 days. And estimations of about 60% of natural conceptions fail to implant in the uterus, and the rate is higher for in vitro conceptions. The next stage begins once the zygote is attached to the uterus. Once the zygote is implanted in the uterine wall, the embryonic period begins. During this period, cells continue to differentiate basic structures such as head, chest, and abdomen starts to develop in the embryo. In the embryonic stage, the heart begins to beat and the organs forms and starts to function. The neural tubes forms along the back of the embryo, developing into the spinal cord and brain. The fetal period. The embryo is called a fetus when the organism is about 9 weeks old. It is about the size of a kidney bean. As the tail begins to disappear, it takes on the recognizable forms of human being. The sex organs begin to differentiate at 9 to 12 weeks. By the 12th week, all body parts of the fetus appear, including the external genitalia. In the following weeks, the fetus will develop hair, nail, teeth, and excretory and digestive systems.
One of the most commonly used teratogens is alcohol. It is recommended that women of childbearing age take great caution against drinking alcohol when not using birth control and when pregnant. Alcohol consumption may lead to neurocognitive and behavioral difficulties that can last a lifetime. There is no acceptable safe limit for alcohol using during pregnancy. Smoking is also considered a teratogen. It has been associated with low birth weight, placenta previa, birth defects, preterm delivery, fetal growth restriction, and sudden infant death syndrome. When the pregnant woman smokes, the nicotine travels through the placenta to the fetus. The fetus then experiences a reduction in blood oxygen levels. Prescription. Over-the-counter or recreational drugs can have serious teratogenic effects. In general, if medication is required, the lowest dose possible should be used. Combination drug therapies and first trimester exposures should be avoided. Marijuana, cocaine, ecstasy, and other amphetamines and heroin can cause low birth weight, withdrawal symptoms, birth defects, or learning or behavioral problems. Babies born with a heroin addiction needed heroin just like an adult addicts. The child will need to be gradually weaned from the heroin under medical supervision. Otherwise, the child could have seizures and die. Environmental chemicals can include pollution, organic mercury compounds, herbicides, and industrial solvents. Some environmental pollutants of major concern include lead poisoning, which is connected with low birth weight and slowed neurological development. The chemicals in certain herbicides are also potentially damaging. Radiation is another environmental hazard that a pregnant woman must be aware of.
STIs that are caused by viruses like genital herpes, hepatitis B, or HIV cannot be cured. However, these infections can be treated with antiviral medications or other preventive measures to reduce the risk of passing the infections to the baby. If the pregnant woman contracts rubella during the first 3 months of pregnancy, damage can occur in the eyes, ears, heart, or brain of the developing fetus. It is found out that this kind of stress is a risk factor for conditions such as behavioral problems, learning disorders, high levels of anxiety, attention deficiency, hyperactivity disorder, or ADHD, autism, and schizophrenia.
Safeguarding children's development necessitates a proactive stance against environmental risks by advocating for sustainable practices, minimizing exposure to pollutants, and fostering a green mindset. We can pave the way for a healthier environment that nurtures the well-being of future generations.